Welcome back to our channel. Today we're diving deep into a crucial part of our circulatory system that often gets overlooked, the celiac trunk. If you've ever wondered how your stomach, liver, and spleen get their blood supply, you're in the right place. What is the celiac trunk? The big picture. So what exactly is the celiac trunk? Also known as the celiac artery, is the first major anterior branch of the abdominal aorta. It originates just below the diaphragm, at the level of the T12 to L1 vertebrae. Think of it as the main highway exit for blood heading to the foregut organs. That's embryological speak for the upper digestive tract and associated structures. The triad of branches where the magic happens. What makes the celiac trunk so special is that almost immediately after it originates, it typically trifurcates, meaning it splits into three main branches. These three branches are the common hepatic artery, the splenic artery, and the left gastric artery. This classic arrangement is often called the celiac tripod. Let's break each one down. Branch 1, the left gastric artery. First up, we have the left gastric artery. This is generally the smallest of the three branches. It takes a course superiorly and to the left, primarily supplying blood to the lesser curvature of the stomach and the abdominal part of the esophagus. It also forms a crucial anastomosis, a connection with the right gastric artery, ensuring continuous blood flow across the stomach's lesser curve. Branch 2, the splenic artery. Next, we have the longest and most tortuous, or winding, of the three branches, the splenic artery. It travels horizontally along the superior border of the pancreas, right behind the stomach, before reaching the spleen. Along its long path, it gives off several important branches. Pancreatic branches to supply the pancreas, the left gastromental, or left gastroepiploic artery, which runs along the greater curvature of the stomach, and finally several short gastric arteries, which supply the fundus of the stomach before the main artery enters the spleen. Branch 3, the common hepatic artery. Finally, we have the common hepatic artery. It courses to the right and, as its name suggests, is destined for the liver. Before it reaches the liver, it divides into two major arteries. First, it gives off the gastroduodenal artery, which descends behind the first part of the duodenum. The GDA then gives off the right gastromental and superior pancreatic and duodenal arteries. Second, the common hepatic artery continues upwards as the hepatic artery proper. The hepatic artery proper then divides into the right and left hepatic arteries to enter the liver and supply its specific lobes, and also gives off the right gastric artery. Clinical significance, the median arcuate ligament syndrome, MALS. Now that we know the anatomy, let's briefly touch on a key clinical correlation. The celiac trunk can be susceptible to compression. In a condition called median arcuate ligament syndrome, or MALS, the celiac trunk is compressed by the median arcuate ligament of the diaphragm, often leading to abdominal pain due to reduced blood flow to the foregut. To quickly recap, the celiac trunk is the first major branch of the aorta and is responsible for supplying the foregut organs. Its three main branches are the left gastric, stomach and esophagus, the splenic, spleen, pancreas, and stomach fundus share a greater curve, and the common hepatic, liver, gallbladder, duodenum, and more stomach. Mastering this triad is key to understanding abdominal vascular anatomy. If this video helped you understand the celiac trunk, please hit that like button, subscribe for more anatomy deep dives, and let me know in the comments what artery or structure we should cover next. Thanks for watching, and we'll see you in the next video.